So in this first video, we're going to just try and reduce the inflammation of your left knee. So one of the first things that I'd recommend you do is continue with the icing, particularly if you're noticing it's swollen or if you do anything that irritates it. Get the ice pack on there, wrapped in a tea towel for 5 to 10 minutes, reduce it, take it off, and then pop it on again in 2 hours time. So particularly if you trigger anything on there, or perhaps after you've done the exercises. The other thing you consider is the non-steroidal anti-inflammatories, such as ibuprofen, as long as you're not allergic, and you may want to discuss that with your GP or pharmacist because they can guide you on the correct dosage. If you do self-administer, please read the package. Don't take more than you should, according to the package, and also do not exceed more than 2 to 3 weeks of taking that, as it can cause damage to the stomach lining if it's taken for a long period of time. Now, getting onto the massage, what I want you to do first, take your hands like this and just gently, in a stroking upwards motion, you're going to encourage the fluid back towards the knee and then up towards the hip and groin here. Now we're doing this to basically return the fluid to the lymph nodes, which are in the back of the knee and in the hip. Really, we don't want to leave it here because we've already got quite a lot of fluid, and gravity is going to also encourage them down here. So encouraging it up and past the knee to the hip is going to help reduce that swelling and return it to the heart quicker, and therefore get that swelling down. So you can just do that for a couple of minutes every day. This won't do any harm. You can't really overdo this because it's nice and light. Sometimes you'll see a bit of a wave in the tissue as you push it up if there is excess swelling there. And you can probably do that over the next week or two, or if you can see some swelling is still remaining around the knee. The next thing that I want you to do is to get in and massage the muscle, a bit like kneading dough. So you're going to just work through the muscle here. You might find there's a few little tender spots. If you do, take your thumb, press into the tender spot there, hold it for a few seconds and allow it to relax off. So I'd say about 5 seconds. When it eases off, you can move on, and if you find another spot, same thing, thumb in there and let that relax off. Now when you head up towards the knee, in the back of the knee there's a muscle called popliteus. This resists rotation. The knee shouldn't really rotate, so when this does end up getting strained, and we do find there's trigger points in the back of the knee, so you can come into the back of the knee here, press and hold for 5 seconds on any tender spots you can find, and then move along, so you're going along the back of the knee there. Now, one thing to be careful in the back of the knee is there is a nerve. If you hit that, you'll feel an electrical or burning sensation, so remove your thumb and push it along a little bit more just so you come off of that, because that won't really do you any favours. The other thing with the back of your knee is you've got a Baker's cyst, so that is that fluid-filled sac we just discussed and that I wrote in the email, and that can be a bit tender too. So again, if you feel you're hitting a bit of a lumpy thing in there, then just shift off of it, because you might well find that you're just hitting that spot there and it's a bit sensitive too, but we're really aiming to get the muscle rather than any other structures. Then you're going to come up onto the front of the knee. The bottom of the kneecap, there's a patella tendon, and I just want you to cross friction that. You might want to straighten your leg for that actually, just to relax that off and get in there a little bit more. And just cross through that. If it's tender, work it a little bit more. Again, all this just do once a day. If it's not tender, then you can just move on, but just make sure you get in all the different angles, because sometimes we have tender spots that's a little bit more hidden. Coming up through the leg here, again, sort of kneading and massaging. If you feel any tender spots, get your thumb in there again, and you can also use the rolling pin as we described, just kind of working through some of these muscles. You might find that a bit easier, particularly if you're doing it on your own, and down through here. And just do this for maybe 4 or 5 minutes, just working through the entire leg, doing those different points with the thumb and using the roller and your hands, just to create some more mobility, flexibility, and reduce the inflammation. Perfect, so that's the first section done of the sort of massage. In the next video, I'll take you through the exercises we discussed.